everyone, it's Dr. Jen from drjenmed.com doing a video today on the warning signs of kidney disease. The warning signs that you may have kidney disease. The kidneys play a vital role in our body. The kidneys are like filters. It filters the blood and produces urine at the end of the day. And what it does is help to maintain the balance of fluid in your body. It maintains the balance of fluid in your body, and not just fluid, but it's the salts, the electrolytes as they are called in your body. It also plays an important role in your pH, how acidic or alkaline your blood is or your body is. It also is very important in your red blood cell production as well as in bone health. So you see, the kidneys serve a vital role because it's very important in getting rid of toxic waste products then from metabolism, especially protein metabolism, right? Very, very important role. So when your kidney is not functioning, you just can imagine that your red blood cells going to be affected, your bones going to be affected, and of course your fluid balance and this toxic stuff are, waste is stuck inside. It cannot get out in the form of urine. Therefore, you can now see why the symptoms you'll have if you have kidney disease are related to when the kidneys are not functioning. The most common symptom you will see is swelling, also called edema. Edema. So this swelling usually is in your feet, your ankles, can be in your hands, and when things really getting bad, you'll see the whole body swell, around the eyes swell up, even your stomach swell up, and if the fluid backs up more and more, you can get even fluid in your lungs, right? So swelling. So don't take swelling feet lightly if you do not have a reason for the swelling, especially if you have hypertension and diabetes, known causes of kidney disease. So apart from swelling, you may notice that you are having itching of the skin. Now, that is not very common in the beginning, but some people will notice that, boy, my skin itching. But I think this is the most subtle symptom people tend to miss. Your urine pattern changes. You may notice that you are urinating frequently at night, so-called nocturia. If you are urinating a lot at night, yes, it could be diabetes, yes, it can be prostate issues, but it is very important to go get your kidneys checked. Does your urine look different? The color, is it looking very yellow, concentrated and small amount? Is it looking dark like Pepsi or Coca-Cola? Is there blood in your urine? Is it looking foamy, bubbly, frothy? Red flag, big red flag. Is the amount less than you are used to? Even though you're drinking what you normally drink, is the amount less? Is there a change in the smell or the odor of the urine? Something is going on with your kidneys. Go get it checked out. Please do not ignore these symptoms. You may feel tired a lot of the time too, and these are some of the classic early symptoms of kidney disease. Now, if you have any chronic diseases, especially diabetes and high blood pressure, every time you go doctor, every 3 to 6 months for your checkup, it's very important that your doctor does that dipstick where they put that thing in the urine and check it for protein, because a lot of the times, that's the very first sign that the kidney is not working. You're finding protein in the urine, and the urine may look okay with the physical eye, but when you check it, you realize that you are passing microscopic, they call it, protein in the urine. And that is why it is very advisable to, go have the urine sent to the lab and they check for this protein in the urine along with other tests. So these are the most common symptoms or signs that you will find in kidney disease. And let me tell you, this is one of these things that if you find it early, it's better to deal with it early before the kidney function deteriorates more and more, and then you have a lot more challenges to deal with. Then you're looking down at kidney failure, when the kidneys totally shut down, they're not filtering, they're not doing them job. So you have a whole host of issues. So again, let me say this again: if you are diabetic, you are hypertensive, keep an eye on those kidneys. You know, we do the blood test to check kidney function, but to be honest with you, by the time the blood test is showing kidney problems, the kidneys are far advanced in disease. So you don't really want to depend on the blood test. You want to get that urine checked to make sure no protein in that urine. Okay? Until next time, this has been Dr. Jen. Bye.